Hello and happy March. It is Kidney Awareness Month, Kidney Health Awareness Month, and I'm joined by Dr. Steven-Gartzman with Victoria ER here to talk to us about the signs of kidney stones. Dr. Gartzman, welcome.
Good morning. Thanks for having me.
So talk to us about the three big signs of kidney stones. We talked a little bit about that it affects everyone, does not discriminate by age, but what are some signs that maybe we're suffering from kidney stones?
Well, most people will have a sudden onset, severe, worst pain they've ever had on one side or the other of your flank or lower back. It's often accompanied by severe nausea, even vomiting. The pain is so severe, and then feel like almost like urinary tract infection pain, the discomfort urinating because of the presence of blood in the urine. Sometimes a little bit, sometimes more than a little bit, and so that's the common three signs that you might be passing a kidney stone.
Nausea, vomiting, and pain in the urinary tract area.
Yes, ma'am.
Wow. And how do kidney stones even form?
Well, most of the time they're made of calcium deposits that start in the kidney and often run in families. And being dehydrated and being on a high salt intake can often precipitate them. And this is one of the most common kidney conditions we see. 2 million ER visits a year, one of the most painful things we see in the ER. About 10% of men will pass one during their lifetime, about half as many women, about 5%. Wow. And yeah. Severe, painful condition, and can be life-threatening too, because these suckers can go anywhere from a tiny grain of sand to the size of a golf ball. So they're
oh dear.
Yes, and so
yeah, wouldn't want to pass that through a urinary tract.
Exactly.
That's demanding a lot out of the body.
Yes, ma'am.
Well, urology, we were speaking earlier about how young of a medical field it is, and before urologists, people would die from kidney stones.
They still can. If the bigger the stone is, the less likely it is to pass. And once it gets stuck, then you're at risk to develop urinary tract infection, kidney infection, and even septic shock, and it can be life-threatening.
At what point do you decide to take a patient into surgery?
Well, one of the things to look for is you develop a fever. That's one of the indications to have an emergency stent placed where the urologist goes in and puts a tube in that bypasses the obstruction and can often blast the stone into smaller pieces so it can pass. But fever and a kidney stone is a life-threatening emergency.
Wow, so definitely stay away from having a TV dinner every night of the week, and have some fresh food, some produce, some water and lemon, some healthy habits to keep those kidney stones from forming.
Yes, ma'am. It's important to stay well hydrated. Lots of electrolytes are key.
All right. Well, thank you so much, Dr. Gartzman, for joining us here at the 25 News Now studios to talk about kidney health.
Thanks for having me.
All right. Well, thank y'all so much for tuning in. Come to crosswordstoday.com to learn more about our coverage and future segments.